The Alpha Site 9000 is very unique in the medical space.
The alpha site can really change people's lives.
It provides a very early detecting of the development of a disease.
The Alpha Site 9000 is a contact regulation thermography device designed to understand the health of the autonomic nervous system and blood circulation around organs, glands, and lymph.
This is how it works. The body is normal core temperature here, and when you expose the body to cool air, what we expect is all the points on the body get colder. So if there's, say, some problem with the liver, very often, instead of cooling when you're in a cool room, these points do not change even though the person is subjected to cool air. And we see other patterns where the point actually heats up and gets hotter.
The fact that different points belong together, that we have typical patterns for diseases, this makes the colleagues be amazed.
With one thermography session, we can pick up all kinds of organ and system disturbances and start a treatment plan right there.
When the patient comes in for the test, we take a brief medical history, filling in the data on the computer program. Your main condition or complaints?
Excessive heat and cold.
Regulation thermometry works with the Alpha Site 9000 using a special temperature sensor that has an infrared coupling. So we're going to start the test. This is a temperature sensor that we use to touch points all over the body. We're going to start with points on the face. We're going to do a lot around the mouth, around the eyes. So we're going to start first with just this forehead point. When the sensor touches the skin, there is no electricity or radiation or anything that goes into the body. The infrared sensor is just taking the temperature that's radiating off of the skin, and that is put into the computer program. So then we use the temperature sensor to gently touch over 100 points on the skin. Okay, that's the end of the first round. Now we've got a 10-minute timer to keep track of the cooling period. And the patient stands for 10 minutes in just their underwear. And after the 10 minutes of cooling, we take a second round of temperature readings at every point.
And this is the genius part, that we measure 2 times is a very sensitive measurement tool, so that we see the slight reaction of the body. And slight reactions are the ones which keep the body healthy.
So we take 2 measurements. And there are many studies that have been done all over the world that have shown that with certain problems, that if you use these logic systems or these mathematical computations of that data, we have established a very high degree of accuracy and predictability.
So once the test is finished, we're able to send the data to the server and get a report instantaneously. The report is generated in PDF format, which the doctor can view right on his computer or any computer, and he can also save it to a file or print it. So it's very versatile that way. Is that report you were looking for? The report is very comprehensive. It includes priorities that are found through the test and recommendations.
It's interesting when I show the thermoregulation test. Here is one. If I show this and I explain them, look, here are the patterns and how they connect together. They say, wow, how do you know about that?
You know, I never seen this paper before, so I went through it, and the first impression was, wow, I could really read this.
After the report, patients are really motivated to follow through.
There are a lot of ways to heal, but I want to be sure that I'm healing. And when I have thermography done, I know what the problem is, I handle it, and then I have it done again and find that the problem is gone. So then there's real evidence that tells me that I'm on the right road to good health.
It's not just for patients, but also for me as a health practitioner who help these patients. So I could confirm my treatment, how that goes, what's next I should do for this person.
Everyone who sees one of these reports really wants to get one for themselves. So the referrals back to the same doctor are just a matter of course.
We've had some of our patients refer other patients for regulation thermography. They had such a positive experience. I mean, who recommends their friend for a mammogram?
MRIs, mammograms, CAT scans, those are all imaging tests that are trying to understand if there's a growth or an aberration in the anatomy. Regulation thermometry is a physiological test. So we're coming at the same problem from a different perspective.
We're looking at the body dynamically, so we're taking two measurements. It's like your cardiologist doing a treadmill test. He wants to see the function of an organ, not an image. They have great imaging equipment all over the world in every hospital. We're not interested in that. We're interested in an adjunct to diagnosis.
We have quite a few women in our practice who are concerned about the mammography guidelines. They're concerned about skipping a mammogram in between. Some of them are concerned about having a mammogram at all. The regulation thermography is a perfect tool for this.
The regulation thermography allowed me to detect several times breast cancer, which were not found in mammography. Because mammography shows the cancer only if it's already here. Thermoregulation shows cancerous tendencies before it's here.
I think it could add to anyone's practice because it gives us a whole different way of looking at the patient.
The amount of information provided in these reports is life-changing in many ways.
To me, I know that thermography has been a lifesaver.
The bottom line about regulation thermography is that it is a true preventative care test.
People are looking for answers, they're looking for more information on their whole body health. And we provide that.
There are imaging devices and there are blood tests, but there's no device that really gives a doctor a holistic view of what's going on with the patient.
There is no other tool which shows dynamic changes in reactability of the body, which is the basis of health, better than regulation thermography.
I want to have medicine look at things from a much wider viewpoint and the whole person. And if we can do this, which we are doing, we see all the factors that lead to disease. We can reverse them at a very early stage.
My bottom line thoughts about the thermography test is that it's real health care. It's real health care.